Thank you.
Okay, live stream is starting right now.
Thank you.
Recording it right now, and I will hop on your computer, Steve, and take a look.
Okay.
Okay, everyone, I have 10:30. I'll call the meeting of the March 18th meeting of the Neighbors of Dunn County to order. Call roll. Looks like everyone's here along with Chairman Bartlett. Everyone's had a chance, I'm sure, to look over the minutes. Is there a motion to approve?
So moved.
Motion's made. Is there a second?
Second?
Do I have a second?
Second.
Good. Are there any questions on the minutes? In hearing none, all those in favor say aye of accepting the minutes.
Aye.
Aye.
Opposed? Carried. Is there any public comment? Hearing none, we'll go right into Administrator Flunker's report.
Thank you, Chairman Johnson. So as always, we start with Quality Assurance Steering Committee. We have this every month. It is our Quality Assurance and Quality Performance Improvement Plan meeting. We had our meeting this month and went over all of the different metrics that we go over, including our safety report this month. We did not have any safety concerns. Besides, we did have a performance improvement plan for a safety issue that did not have any actual concerns, but we did have some heating units that were out that we were monitoring to make sure that we didn't go below the minimum heat that we are required to have, which a couple of rooms heating units did. So we wrote up a plan of what the actions were done to keep people warm, keep the building warm, and then our performance improvement plan going forward for that as well. So Josh in facilities presented that at our quality assurance meeting. And then we also went over our COVID stuff because that is a big part of our QA at the moment, but we can get into that later. Any questions about QA? Okay. Next is the employment activity report. And just because this kind of fits into that, I'm going to add something on before we get to Chris, that goes into employment. So in the last couple of months at our meeting, we've had questions about wage studies and things like that for nursing. And I've been working with Heather on that. Chris had contacted our other local, or not local, but the state county owned nursing homes in our state for wages, and some got back to us on that, some didn't. And then we are also discussing the difference between us and some other locations, as we have a lot of competition with non-nursing homes, which would include Mayo and Sacred Heart and the other hospitals and clinics, which is a big part of it as well, because it's not necessarily comparing apples to apples when we compare to a rural county home that doesn't have multiple hospital systems close by. Which I then talked to Heather at length a couple of times with this, and then even this morning. And she said she was comfortable with me sharing that they are asking for an RFP for interviewing for class studies for all the positions in the county, which would include our nursing positions. So that will be part of that, and hopefully this year. So she kind of said, hold off a little bit because that'll be part of that whole class study instead of doing the work twice when there's people being paid to do that coming up this year for the overall county as well. So she said it was okay if I shared that with this, and it kind of fit in with the employment activity report as well. And then I'll refer to Chris for the rest of the employment stuff.
Hi, can everybody hear me?
Yep.
Okay. So I sent out that employment report with the financials. It's in whatever you would have received a little bit after the initial packet. So if you look through here, the number of interviews scheduled, And that's just for in-house interviews. That was 6. The number of interviews held was 6. Everybody did show up. Number of positions offered was 6. Accepted were 5. And with that, it was kind of the tail end of February. We had a couple candidates who had to leave like a 30-day notice at their previous employer, so that put them into a March hire date. So on March 10th, we had 7 people start. And then I have one here today starting that was kind of an off-cycle one that couldn't get into the March 10th orientation because of, leaving a proper notice at her former employer. So out of that group, there was a homemaker, an LPN, and then a total of 6 CNAs that started. During the month of February, we had 4 resignations. It was 2 part-time CNAs, a part-time CNA had finished school, I think, as a respiratory therapist and just no longer had any availability to work here. A full-time CNA, she accepted a different job, wasn't an overly good fit here. And then a part-time LPN who was in her final semester of the RN program and just needed a better work-life balance. She was a non-traditional student, so she had children, was trying to balance everything, and what time she wasn't in school, she wanted to spend with her family. And then we also had a homemaker that had decided to resign. So if we want to go on to the open positions, it's kind of been updated. The thing under CNA, I guess I need to make a correction on. It's not 31.6 full-time employees, it's 31.6 FTE equivalents. So that could be a mix of like a 0.6 or a 0.4 or, or a full-time employee actually, but it equals up to be 31.6 FTEs. 14 at the moment, or 14 for February, were filled with agency CNAs. Currently, we have no agency RNs and we have 1 agency LPN. So it's kind of a 2 agency LPNs. I'm sorry. So it's kind of the up to the minute open positions. Active leave of absences, they're down a little bit. Of course, we have the 8 CNAs that are on a an educational related leave of absence, and then 1 part-time CNA that's on a active duty military leave. I'm going to go down to work comp last hours. February was a good month. We didn't lose any hours due to a workplace injury. A number of shifts missed in February. I forgot to change that from January to February, but the data is correct. It was 51 missed shifts, or roughly 460 hours, because it was a mix of 8-hour employees and employees that are working the 12s is how I came up to the 460 roughly lost hours for COVID related type stuff.
Mr. Chair.
Yes, go ahead, Mike.
Chris, before you move on, back up to the CNAs, the 31.6 full-time equivalent positions. Does that mean we have approximately 31 full-time positions and we're only able to fill 14 out of those 31?
No, but 31 full-time equivalent. So it could be, a full-time equivalent is a 1.0 would be a full-time person. A part-time person might be 40%. So that's all into that 31. It's not 31 full-time positions open.
Full-time equivalent positions.
Full-time equivalent, yeah.
Well, that means basically the number of hours that 31 full-time people would have. The number of hours.
In essence, yeah. Can I say something?
Yep.
This is Paula.
Absolutely.
Okay.
Oh, Paula. Okay,
Can I
good.
say some-
I'm
can I say
confused.
something quick? Okay. So Chris has on here the 31.6 full-time equivalents. Out of that, there are 22 of those that are actually full-time positions that we do not have filled. The rest of that is part-time positions. So like what you're saying, Mike, essentially it's 31.6 positions that we're unable to fill. And when Chris talks about the employment activity report, this is like from February. I mean, we're already mid-March and there's already more that has happened. I mean, I guess I just feel like I need to, talk about this a little bit, but we currently have an RN that has possibly going to be leaving due to going to Mayo. She's meeting with us later this afternoon about a higher wage. So I'm very thankful that you guys are looking at the wage study and stuff. And like Carmen had said, the hospitals are what is our competition around here. It really takes a special nurse to be a nursing home nurse. A lot of people think when they're going into nursing, they need to go into the hospital because that's where nurses work. But really, nursing homes need that nurse as well. And we need to try to figure out some way to get people to stay here as far as a longevity type situation. The Neighbors has always been really great about having long-term employees, but that doesn't seem to be the situation anymore. And we need to figure out why. When Chris and I have kind of done interviews and things, majority of the time what comes up is money. And I know that we have to look cautiously at that, but I do want you guys to know that that's what staff are kind of looking for right now. And obviously our current staff are out looking for employment. This is why this one nurse has requested to talk to us. She said she's going to be making quite a bit more money at the hospital. This is a nurse that is a full-time RN and she's a strong RN. We need to have RNs in the building basically at all times due to our Medicare and due to other laws and regulations. When we get rid of another RN, that's another whole 10 days of pay period that we're looking for somebody to work. We do also have an LPN that is finishing her RN class, and I get that she'll probably, be going on to work as an RN, but I have been getting referrals for recommendations from her, so I'm assuming she'll be leaving us soon as well. Chris talked about the number of interviews scheduled, and that was 6, and that's saying that's the in-house interviews. That is not including the interviews that Chris and I are doing almost on a daily basis with agency staff, which consume a large amount of our time. When new employees or even just agency staff come, they have to be orientated as well as everybody else. So the interviewing time, the orientation time, the teaching time, stuff like that all takes into account. And we're running into the situation where we have 43% of our staff are agency staff. And so there's times that there's probably one regular staff on duty compared to the rest are all agency staff. And I really want to figure out how we could keep people here. How do we get people here for longevity reasons? We have agency orientating agency, and that doesn't work. I mean, they haven't been here long enough to orientate somebody. And yeah, I mean, so there's a lot, to, go over and stuff like that. And, Carmen and I have talked about it, and we understand that nursing is a profession that's very hard right now, especially with this pandemic. All the nurses are struggling. It's like we've been in this for a year, and we've finally seen a little bit of light at the end of the tunnel by letting visitors come in and stuff. But it has been hard, working and trying to keep people happy, all of the time, let alone the managers being frustrated as well. We're trying to talk to staff, keep them calm, keep them, upbeat and saying, yep, we're here, it's all going to get better, things like that. And honestly, I think sometimes they think we're all lying to them, which we're not. We're trying to make it better. But I did just feel like I wanted you guys to know that we do have 43% that are agency, and a lot of those are CNAs. And I think that CNAs, it's almost kind of a dying field. I mean, I do feel that our CNAs here at the Neighbors do get paid very well. But it's just something that people go elsewhere to work because it's not as hard of a job to do. I've also found that a lot of people are now going to traveling instead of going to work at a certain place. A lot of places, or a lot of the people that I have interviewed that will be coming here shortly, this is their first traveling experience. You know, they talk with other travelers that are worked in the facility and they find out that they can do this or do that and go here and go there and get paid relatively the same amount of money. So just something I thought you should know, and that, you know, there is action even happening already into March already, which won't be reported until next month. So anyways, if you have any questions or anything, but.
Mr. Chair, could
Yes,
we
Mike.
follow up on that as long as we're in the employment area?
Yes.
Okay. Well, first off, I want to clarify, I'm not quite sure what your answer was yet. When it says 31.6 full-time equivalency, I know what full-time equivalency is. That's 31.6 times whatever full-time is. So are we filling those spots with just 14 pool people?
So,
Currently have a, you want to go, Carmen?
oh, well,
I
it
mean,
doesn't matter.
this is, excuse me, this is a snapshot. I don't mean this very minute. but-
Yeah.
In theory, looking at this report, if this was what it is right now.
Yes, so there's 14 CNAs right there at this report. Like, obviously, that, like Paula had explained, there's things that have changed since these numbers were there, but they're also filled with people picking up shifts, people working above their FTE, things like that. So those are the available positions.
Okay.
But so then there would be agency staff that was working overtime, our own staff working overtime, as well as people who may only be on like our books as a 0.2 or a 0.4, working more like a 0.6 or even up to a full-time equivalent. So part-time people picking up shifts, things like that. So the 31.6 full-time equivalent would be if we filled every position we had with simply, if every 0.2 just worked a 0.2, if every 0.6 just worked a 0.6, that would be the amount of positions that aren't full.
Okay, so both you and Paul are really explained the position we're in, and which is not good, but we're not alone. So just follow up on that. So those 14 pool nurses, pool CNAs that got hired. So when we go later on and we look at how much we paid for CNAs in the month of February, for example, we would just take 14 times whatever they're making, $42 would be the minimum for the pool pay, times 40 hours, times 4 weeks. But these are the ones that money is based on?
Yeah, so that money would be based on them. Unfortunately, as far as invoicing and things like that, it doesn't always line up exactly because of when the bills get sent to us, when we get them paid and checked out. So because it's such a moving target, it wouldn't equal exactly that. But yes, in theory, that would be the number, should be, that is what we're paying for, is those 14 CNAs and all of the
Okay.
hours that they put in. But it is oftentimes more than just 14 times 40 or 36, or depending on the amount that they would be full-time scheduled for, because they are picking up overtime shifts as well.
Okay, thank you. And I'm going to bring this up when we get back to the financials and look at that. With your permission again, Mr. Chair, I'd like to kind of follow up on the pay thing that Paula talked about. I brought up in the past that pool people got paid COVID bonuses for over a year now.
Yep.
And
So-
regular staff has gotten nothing yet, have they?
So there's nothing yet. It is in the works. So that should be coming to the Committee on Administration this month. So it's already been hashed out with HR. There's a meeting next Monday about it finances wise, with Keith and Jane. And then it should be on the Committee on Administration this month, which then would go to county board, or exec, and then county board. So it actually won't go through our committee, because it would be a Committee on Administration through HR. So we have it's the next time they meet, I believe, is when the goal was to get that on the Committee on Administration. I believe
And
Paul
that,
got done, because
retroactive proposal?
it is going to be more of a lump sum bonus based on hours worked over the last year for COVID-19.
I'm sorry, Mr. Chairman, I don't believe we have it on the March agenda for Committee on Administration.
So
I don't
yeah, the
think-
next one.
It'll be April.
Okay.
I'm finally done, Mr. Chair. Thank you.
No, that's fine. So then it'd be acted on probably by the county board in May then, evidently.
May.
Okay, all right. Got everything questions answered there, Mike?
I think so. Thank you
Okay.
for your
Well, that's fine.
permission.
That's great. That's great. Okay.
So while
Chris,
we're, oh,
go
sorry.
ahead, Carmen.
I have a
No, that's
question.
fine. Go ahead.
Are we,
Yes,
are
Sarah.
we still doing a lot of mandating of employees?
At times, yes, when need be. If we cannot find someone to come in and pick up a shift, we always try to get voluntary people first. And then if we can't find someone to volunteer to pick up the shift, we do have to mandate people.
And another question, are these bonuses only going to go to full-time employees?
No, it is going, and it's not based on FTE also, it is based on hours worked. So if someone is on the books as a 0.2, but was working full-time hours, it's based on hours worked. But it's
Thank you.
not going just to full-time employees.
Thank you.
While we're on the employment activity report, I wanted to mention something that didn't make February's report just because it was in the first week of March, but by the time we get to the third week of April, it'll be old news by then, or not old news, but we'll be late. So we did have another resignation the first week of March, which was actually a management position. Sally Rock, our life enhancement coordinator and volunteer coordinator, resigned her position here. So actually tomorrow is her last day. So she has been here 22 years, I believe. And she will be leaving to pursue something outside of nursing home. So she will be greatly missed. She put in her resignation the first week of March. So just borderline of the report. So I thought it was important to mention in this committee meeting instead of waiting till next month. We are actively looking for a replacement for this position. The posting for the job comes down on Sunday. So we do have a few applicants at this point, and we'll be trying to replace this position as soon as possible, as it is a very important role here as well. So I'm hoping to start interviewing shortly after the posting comes down on Sunday.
Okay. Environmental, I believe we're that far, right? Am I
Mhm.
correct? Scott?
Oops, actually, we skipped one.
Did we skip one?
Yeah.
Residential referral report. I'm sorry.
That's okay. That is me again. So as always, you have the referral report. We are seeing a little bit more referrals, and we're able to admit this month, so that was good. We did have a little bit of time frame that we weren't able to admit due to having some COVID positive staff. But it wasn't the whole month as previous months have been. So it kind of ebbs and flows with any time we have a positive staff person. And we did have some during the month of February. So we, at one point, all 3 facilities were not able to admit. So that did put a little bit of a damper on our admissions. But at the beginning of the month, we started with 108. We had 38 referrals and 11 admissions with 27 not admitted. We had 1 person that was currently COVID positive. We had 5 people that went to a different facility. 3 were to swing bed and 2 were to a facility closer to home. We are still seeing that trend of having people be admitted all over since nursing homes may be in an outbreak and not able to accept admissions. So we're seeing referrals from further away that end up going to a place closer to their home, which is a good thing for those residents. We had 2 people that were not in network with insurance. We had 5 that were severe behavioral issues. We had 2 that expired at the hospital. 7 people went home from the hospital. That has stayed pretty consistently high since COVID, people not wanting to be in a nursing home right now, which is very understandable. And then we had 1 that had no payer source, and we had 4 that were not admitted due to our COVID restrictions. We had 4 referrals during the time frame that we could not admit. At the end of the month, we had 108. We had 0 people transferred to other facilities. We had 5 deaths this month, none of which were COVID related. And we had 6 people discharge home from the facilities. And then we had the same referral sources as normal as our primaries, which was Eau Claire, Menominee for Mayo, and then Sacred Heart in Eau Claire.
Thank you.
All right.
Now we're up to Scott. Now you're on.
Good morning, everyone.
Morning.
Oh, the last month has been pretty much straightforward as far as work orders, some equipment repairs. Still have Dostal Geothermal looking at issues with the heat pumps and haven't come up with exact answers yet. He's gathering information as far as what is exactly going on and what we could do with that. We've also been kind of addressing storage issues at the facilities. It's been a struggle from day one, not having enough storage for everything. The garages get cluttered up in that. So we're addressing storage issues with, especially like right now, all of the Christmas decorations have been taken out of the building. In previous times, they've been stored in the garage areas. Like Central Garage has a loft area, shelf area. Clean that out. We've got them. We're getting them out of the building into another building for storage for during the year, because they only get used once a year. Makes more sense to keep that storage space in the garage area available for other things that are more important. We're working on those challenges. So the guys have been pretty busy with moving stuff around, work orders, and any equipment repairs that have come up. That's about all. Any questions?
Thank you, Scott.
Thank you.
Okay, we'll go into vaccine administration, Carmen.
So vaccine administration, we have had our 3 vaccine clinics now with Walgreens. That's a federally funded program that Walgreens and CVS did at all nursing homes. So we had our 3rd one at the beginning of March. All went very smoothly. We have over 200 individuals who have been fully vaccinated, received both doses of the Moderna vaccine from the neighbors. And then we have other individuals that either came to us vaccinated or with 1 dose, or staff that have come and wanted doses and been referred over to public health at this point. We have done the work that it is to become a vaccinator site. Right now, we're just waiting for vaccine. Our pharmacy that we contract with for our regular medications will be the one providing the vaccine to us through their means once they have an ample supply. At this point, they aren't starting new vaccinator programs at places like nursing homes. So we are just waiting for vaccine. But anyone that is a new staff member that would like the vaccine, or if it is a resident that we can get to public health, they still are prioritizing phase 1A, even though other phases have been opened. So if anyone does want to be vaccinated, we can make that happen through public health or a local hospital or clinic system as well. So hoping to get more and more people vaccinated. And it went very smoothly for all of those clinics. So but we are excited to become a vaccinator so that we can do it similar to how we do flu shots or TB skin tests here on site for new staff members.
That'd be nice. Yeah.
Any questions on vaccines? Okay, I'll move on to just general COVID stuff then. The biggest news of the COVID world is the visitation policy. So that was a very exciting thing, fresh off the press last Thursday. So we are able to have visitors at the neighbors now, which is very, very exciting. It was almost a year to the date. March 13th of 2020 was the day our doors locked, and they reopened on March 11th. So 2 days short of a year. It was a very good day to see families come back in. There are still some restrictions on the visitations. Everyone has to be screened at the door. So our doors are not completely open for anyone to just walk in. They still have to ring the doorbell, be greeted by a staff member that then screens them for any sort of symptoms or exposure to anyone with COVID. Vaccination status of the visitor does not play a factor in visitation either way. If they are symptomatic but vaccinated, they still cannot come visit. Or if they are unvaccinated, it doesn't mean that we bar them from visitation. So the vaccination status of the visitor does not affect their availability to visit. Vaccination status of the resident does play one role in how some visit interactions can take place. Per the CMS memo, if a fully vaccinated resident, meaning it's been at least 2 weeks since their second dose of either Moderna or Pfizer, or 2 weeks after their single dose of Johnson and Johnson, that they can, if they would like, have physical touch with a resident or with a visitor. So if the resident is fully vaccinated, a visitor can hug their loved one or hold their hand and have actual physical contact if the resident would like so. So that's really exciting to see residents get hugs from their loved ones. Was a great day on Thursday. So that's the only thing that is vaccination related for the residents side of things. Otherwise, we still encourage 6-foot distancing. Visitors must be wearing masks. We have hand sanitizer, all of the things like that that are the core principles of infection control still have to be followed. We have seen a bunch of visitors. It wasn't a crazy influx like we thought it was going to be necessarily. So it was nice that it was more of a steady people coming in and out instead of everybody rushing to the doors, because that would have been a little hectic as well. But it was a very good transition to having people in the building. The only thing that would bar visitation from continuing is if we had an outbreak. So it's another motivator for people to stay diligent on infection control practices, wearing their masks, social distancing, because staying healthy also can keep our doors open. If we have an outbreak in the facility, we would have to stop visitation to that part of the facility at a minimum. So if, say, there is a central staff person that worked primarily in Fireside or worked just in Fireside, we would have to stop visitation of all of Central through at least one testing cycle. And then if that testing cycle came up with no new positives, we could open the other households in Central, but Fireside would still have to be closed for the second testing cycle, meaning the full 14 days. So a minimum of any neighborhood or facility affected would be 7 days, and the actual household affected, it is a minimum of 14 days. And it's from the most recent positive test. So that we continually have like a positive test, then 2 weeks later, a new positive test, that 14 days starts over. So it is really important that we keep staff and residents healthy so that we can keep people coming back in. So, but it all in all has been a good transition to having visitors back in the building.
That's great news. I actually heard it on Eau Claire News yesterday or the day before that Neighbors has opened up for visitation. So,
is there any questions on that at all? Is there any other COVID-19 related questions? Okay. The only other thing we have from COVID, I know Chris touched on it a little bit, but we are still seeing lost hours due to COVID. That's not necessarily because of COVID positive staff. We've actually, knock on wood, but had better staffing situations with COVID positivity rates. But we have had several staff be close contacts of people, or if there is staff that are exhibiting symptoms. So they still do have to be off pending COVID-19 tests, as well as 72 hours post last symptom to make sure that they're not spreading infectious disease in the facility. So those are still considered COVID lost hours, even if we don't have positive staff. All right. So the next thing on the agenda is survey activity. So a couple things on this. We did have a complaint survey in the middle of February in the central building. It was a one-day survey. We had 2 surveyors here. It was not COVID related. It was related to staffing numbers and ratios of staffing. So we did have a complaint survey. It was found unsubstantiated with no citations. They look at the amount of staff to residents is the biggest thing that they were looking at, which we were much above the minimum. And actually, the day they came in, when we calculated out the hours, we were almost double the minimum staffing for that day for the building, especially in Central, where we have a lower census right now. We had quite a few staff in the building when we had, believe that day we had 8 residents in Fireside. So we were fairly low on census as well. But they look at our staffing schedules and sheets and hours, as well as talk to residents, questions about, are you helped in a timely manner, things like that. And they had no concerns while they were here. So we received no citations from that. And it was unsubstantiated. Also on the survey topic, they are resuming regular surveys now. We have not had our annual surveys in over a year. East is almost 2 years out from their last survey, and Central and West are about 1.5 years. Surveys had been postponed due to COVID. They were only doing infection control related surveys and complaint surveys throughout the year of 2020. So now they are starting up regularly scheduled annual surveys. So we will be expecting them in East anytime now, because we would be in the window as of last year for this time. So we are almost 2 whole years out. So we are expecting them in East. I do know other local nursing homes have had surveys. So they are started up again. So it'll be good to get on a regular schedule and have it be a little bit back to normal as well with that. Any questions about surveys at all? Okay, and last on my report is the census and case mix. That's always on there. And I know we talk about this a little bit more in finance now. But as you can see, the census has still remained lower. We had gone up quite a bit from what we were at before in January. But this month it has kind of leveled out right at that 108. We are in 110 for a little bit, which is below budgeted census. A lot of this is Central. East and West have stayed full. As you know, Arrowhead had closed down back in November due to census, and it remains closed at this point. We are using that space right now for testing clinics, and then we had that as our vaccination clinic as well. But census is low in Central. We are staffing to census levels. So if we have a lower census, we have, instead of maybe having 2 CNAs and a nurse in Fireside, we'd have 1 CNA and a nurse, trying to accommodate for the number of census as well. Does anyone have any other questions for me?
Okay, thank you, Carmen.
Well, I think
I've-
Chairman
Oh,
Burke.
Go ahead, Mr.
Well,
Supervisor.
I'd like to go back to that referral report
Sure.
and the no payer source person.
Mhm.
Explain a little bit more about that. I'm wondering why somebody can't get Medicaid or whatever. Can you enlighten me a little bit what happens to that person, or who what type of person it would be, what type of situation?
Sure. So I don't know specifically about the person from this month, but I can give a couple of different scenarios that could potentially have been that person. So it could be someone that doesn't qualify for Medicaid. If something happened and they don't have a disability and they are not old enough to qualify for Medicaid. It could be someone that has too much financial wealth to qualify for Medicaid, but not enough to pay to be here. So if they are above assets, there's a limit on the assets that someone can have to qualify for Medicaid. And that can include things like houses and different property as well. And sometimes people are not willing to get rid of that to qualify for Medicaid. Medicaid application is also a fairly big process, and some people just won't do it. We do offer services to help with that, and so does the ADRC, the county's ADRC here. But sometimes people just won't do it to actually qualify for Medicaid. And we don't always accept Medicaid pending as a payer source, because if we don't know if they're going to be approved for Medicaid, we could be on the line for the money that they would occur here, the costs that they occur here, if Medicaid doesn't go through. So if they haven't done that process yet, we don't have any guarantee of getting payment either for them. Does that answer your question?
Yes, thank
Okay.
you. Explains it a little bit. Thank you.
Sorry, I didn't notice you, Dave. Are there any other questions for Carmen? Hearing none, are there any questions on the vouchers? Okay, we'll move on to financial report with Jane. Good morning.
Hello, thank you, Chair. The financials, not sure which page you guys have on top. If we could start with the, say, the pool staff. As Carmen mentioned, we don't always get the invoices in exactly the day they come to us, so there's some delay. And then that carries at the end of the year, that matches up. But CNA continues to be the largest pool staff bucket that we have. And it's under the average of last year. So far, so good, I guess, relatively speaking. Any questions on the pool staff report?
This is the one I did want to ask about. Is it okay, Mr. Chair?
Absolutely.
Okay, for example, going back to the 14 full-time equivalent CNAs, if they were full-time equivalent at 14, we'd be paying them about $94,000. And it's $68,000, and I understand that, you know, the invoices don't line up and stuff. But it's important to me to know that, you know, that's 50% off almost. And I assume January we had 14 or so CNAs. So it's quite a bit off, unless I'm doing something wrong, but 14 times 40 hours per week times 4 weeks times a minimum of $42 an hour for the pool pay comes out for way more than both of those numbers. And I'm just looking at CNAs. Am I doing something wrong there?
Mike, are you just looking at CNAs just in the top, like on the blue line, February CNA? Because that is just in the East building.
Ah, okay, there we go. That's what I'm looking at.
So that's for the East
So-
building. And then if you
Got
go
it.
down to the yellow, and then there's CNA, that would be the 7. And then down to the green CNA is the 42.
There we go. Thank you.
Mhm.
So now it's more than that, and that would be the overtime and the extra shifts and everything.
Correct.
Okay, thank you.
That answers your question, right, Mike?
Okay,
Oh, you don't know until you ask.
That's right.
that's right. Okay, moving on to the aging report. It still has a 12-month rolling history. We ended the month at another record low of $1,155,000. And last month I said that was about as low as it could go. So we keep improving. And the buckets of aging, I guess part of that could be down to low census where we don't have as much in the current in the 31 to 60 days. But it's still 70% of the aging, which is a good sign. And the 22% at the tail end is things that are kind of stuck or payment plans. People continue to do, they pay on their bill, so it might go down a little bit. And then, of course, as time goes on, more things get added to that very end bucket. So, but I still feel confident we can do well here and keep that up. Any questions on the aging?
Looks good.
Okay. With aging, I thought I'd give you a little update of the write-offs in 2020. We had $251,000 in write-offs. 121,000 of that was truly uncollectible, like people who had divestments in Medicaid, or they passed and the estate had no money to give us, type of thing. And about 130,000 of that, if we were fully staffed and things had been processed timely, was preventable. Okay. And then for the income statement, as Carmen said, the daily census is off, so and the occupancy rate is down, so our revenues are down. You'll see a blank in the senior meals column that wasn't in at the time of running the numbers, but I did estimate it toward the bottom as about the same as last month. So that will be compensated for at the bottom line there. Medicaid continues to be more than budgeted. Private pay is under the budgeted amount. VA is kind of holding its own. And the budget is based on pre-COVID. So you'll see a budget amount in the bistro. You'll see senior meals budgeted pretty much as they were, even though we're getting more in than we thought. So any questions on the revenues? Okay, the expenses are holding their own too. Pretty much, in the beginning of the year, some of these percentages of the year-to-date budget variance could be off because they're small numbers. The bistro is off 89% at the end. That's just, small amounts, but the percentage looks big. Therapy, of course, we're not doing as much outpatient therapy. The salaries are what they are. And then at the bottom, you'll see also that the COVID payments have been removed from the income statement. Those have gone into deferred revenue. And then what we will do is apply those amounts at year end. So at the end, year end, well, I'm getting ahead of myself. The net income and loss is $14,000 off. So the less residents, fewer meals, that kind of thing. So we're kind of holding our own there. Going back to 2020, the COVID expenses claimed, as I said, the expenses are embedded and we can't pull those out. The revenues, we know what those are. But in 2020, we had $486,000 that we can claim as COVID expense. So that includes payroll, parts of Carmen's salary, the actual COVID expenses of the PPE, the daily rate of our meal costs went up because the actual food costs went up. That was another almost $18,000 per day per person. average. So that total helps us out too. We're not sure how that extra money, when we post that to our revenues, how that will affect our cost report and the supplemental payments. County facilities receive the supplemental payment based on their Medicaid census and the shortage of what we cannot cover for the cost of care. And if we're getting this extra money, we don't have as much of a shortage. So the potential is that 2 years down the line, we may not get that supplemental payment, which is a huge amount of money. There's a meeting tomorrow with the state that I'm going to listen to. They haven't decided how they're going to process cost reports and how they're going to handle that money yet. So stay tuned for that. We're hoping that they don't penalize us for receiving those funds. And I will keep you posted on what the state decides on that. I did some calculations on the days that we are short so far and a projection. Our bed days so far this year are 6,125. The budgeted is 6,297. So we're short about 86 bed nights per month, which translates to about $242,000 per year. So if census continues to be off, we would obviously project a loss of about $240,000 in revenues. The retention bonus, I have one comment on that. It needs to be paid out by June 30th per the Provider Relief Fund's rules. So I'm not sure if it doesn't get to the admin budget until April, if that's too tight of a time frame to get that out. But we have to keep that in mind, that the checks have to be out by June 30th. And that is all I have. Are there any questions?
Well, if the checks have to be out by June 30th, Jane, and it's voted on by the county board in May, it should be all right, shouldn't it? We should be
I
able
would
to
think so.
Okay. Okay. That's a good idea to keep an eye on it. Are there any other questions for Jane?
So I do have one more item.
Sure, go ahead.
We have filled our empty position with the biller. The biller position was empty since about Thanksgiving, and we had a part-time FTE filling in, which did wonders. She knew exactly what our software was. She'd been previously trained on that, so that was an easy fit. But we do have a new biller who is 75% NDC and 25% front desk administration. So we'll have a backup position for Kim and also another full-time body in the office that can help out finance and administration. This is her first week.
Good. So no other questions for Jane? And hearing none, is there a motion to approve the vouchers and approve the financial report?
Move to approve as presented.
Motion made by Kelly. Seconded by someone? By Sarah. Are there any other questions? Hearing none, all those in favor say aye.
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 Opposed? Carried. Okay, in our packet, as we discussed last month, in our packet, we have the directional plan that we are to discuss and set up a policy, and the employees did, I'm sure it was Carmen, maybe, I don't know, did a nice job at sending us this. How do we want to proceed with this, Carmen? Do you have any thoughts on that, or Paul, are you with us? Oh, there he is. He's back.
And it wasn't just me. Primarily
wasn't,
Paul
okay.
put it together. So
Okay, well, good. So-
I think that has more to do with blame than credit. But so last month, along with all the other standing committees, this committee was asked to look at initiatives that are in the county's directional plan with an eye toward crafting a policy and identifying implementation techniques. So the staff report that you have, staff has drafted a policy with respect to the neighbors. It should be fairly clear, but perhaps for the record and for any who might, no doubt the hordes of people watching online, as drafted, the policy states Dunn County is committed to operating the neighbors of Dunn County as a thriving, fiscally self-sufficient skilled nursing operation to help meet the healthcare needs of its citizens through the devotion of all necessary resources, time, and attention to assure the physical plant, healthcare services, food, and staff are of the highest quality. So question number one for this committee is there any element of this policy as drafted that you would like to see changed, eliminated? Are there elements that we've left off that we want to add? Or is it a good policy statement, given the values of this committee, that it would like to express or forward to executive for consideration of inclusion into our directional plan as the policy for the neighbors?
What are your thoughts?
Looks pretty solid to me.
Did we leave anything out? Bear in mind, a policy is an expression of just that. It's a goal. It talks about the value. It is not the plan for how you're going to achieve it. But it's a statement to anybody who reads it about our priority and our commitment, if you will. You'll find, by the way, for those of you, since all of you are on other standing committees, you'll find similar format on other policies that are part of the directional plan that staff is crafting, because there should be a certain consistency in terms of talking about the county's commitment to these various elements. But is there anything glaringly obvious that we've left out of this policy statement? Sarah, Supervisor Kennedy, you were with the health center for many years. Do you have anything particular that you feel this policy misses? You're muted.
As long as any policy has to include how our staff is looked at. And I don't know if that's in here because I don't have a copy right now.
Okay, as written, we want to assure that the policy says that the staff are of highest quality. When we look here in a moment at the implementation techniques, we have specific processes, programs, or intentions that address taking care of staff, both in terms of training and compensation.
That's good. I like to see the staff get something, not get something out of it, but that they are basically recognized.
Right, and in fact, in crafting the policy, what Carmen and I wanted to do, we added we include the word staff of the highest quality, because we recognize that the success of the neighbors as a venture is entirely dependent upon the quality of staff, which means taking care of staff in terms of compensation and benefits. If I may ask to Supervisor Kinnear, I know that you've given a lot of thought to a lot of these elements related to the neighbors. Is there anything that you feel should be added or modified to this policy statement?
Thank you, Mr. Miller. No, the policy statement, as stated, is a general policy statement, and I think it covers.
Okay. And then finally, Chairman Bartlett, anything else that you would want to see in there?
No, it looks good. Covers the things that, it looks good.
Okay, appreciate that. So the second part is the implementation techniques. And it's one thing to have a policy, it's another to talk about how you're going to pull it off. And I'm not going to read verbatim all of the listed. We have 10 implementation techniques, but they cover the gamut from quality of care to having positive survey results, to our relationships with the healthcare educational programs in the area, the various applications, in-person events, the senior meals providing, the bistro, its viability, looking at cost savings across the board, improving how we get reimbursement and our financial results, our fiscal responsibility and solvency. We want to make sure we state explicitly that the goal is that the neighbors not be reliant on tax levy for operational costs, and that eventually reimburses for the loan that was taken out for its construction. We talk about improving staffing skills through performance evaluations, ongoing training, competitive salary and benefits, and then trying to build the profile of the neighbors as an employer of choice for CNAs, LPNs, RNs, et cetera. So you've had this, hopefully you've had a chance to review these implementation techniques that we've put together for your consideration. And this is the opportunity for any of you to weigh in on any of the ones we've provided, or point out any that we've left out, or that you think should be added, or even if you think there's one that is inappropriate, letting us know.
I think it looks good personally.
We've tried to be comprehensive. We tried not to leave anything out of that litany of implementation techniques. And again, bear in mind, the overall goal here is for the committee to forward to the executive committee as one of the standing committees. It's also, so to forward the policy statement and the implementation techniques, ultimately to incorporate those into the directional plan itself for the county, which is why, if you look at these implementation techniques, there's a lot of meat underneath it that's implied, a lot of detail that's not included. But that's because this isn't intended to be a iteration of the elements of all the implementation techniques, but rather a recitation of what those techniques are. The details belong elsewhere than in the directional plan. But if adopted, it actually provides direction to this committee and to the staff as to where to devote time and resources. So it doesn't break down the implementation techniques by very detailed, but we wanted to be comprehensive in the coverage.
Mike, you had a question?
I did. I actually have two. Number 7, plan operations. I wonder if we can somehow include some sustainability in there, environmental sustainability or something like that. That's the first question. Is that a spot for it?
Yes, we can. In fact, that's a good addition that could go as an item D, to be environmentally sustainable and reduce carbon footprint for the operations and facility. And by the way, I pull in rank here. Carmen, are you taking notes on this? Thank you.
Okay, and now the second one, the policy says committed to operating as a thriving, fiscally self-sufficient, and I agree that's a good commitment. But I wonder if we need to be more pragmatic. And I've got 3 things I'd like to throw out.
Go ahead.
Mike, you're
Mike, we can't hear you.
No, you're still muted.
I think it might be your headphone rather than the.
Did you tap your that button on the side of your?
Can you hear me now?
Yes.
Yep. Start again, will you, Mike?
Except I can't hear you. Yes, let me try this.
Is your sound on, Mike? Can you hear us through the computer? Apparently not. Randy, are you able to remote into Mike's?
Can you hear us, Mike, now?
Oh, I can hear you now. Can you hear me?
Yes.
Okay, okay, I don't know what happened. Well, anyway, I'll start again. I know that the policy is that we want we're committed to operating a thriving, self-sufficient. I would like to look at that in a pragmatic way in our techniques. I think we should do three things. All educate, whatever order, and I'm throwing this out for the committee to look at. We need to educate the board members, our 29 board members, that the neighbors is worth it. We need to, maybe the public too, but I'm talking about something specific here. We need to say that you have to understand the nursing home situation in general, educate them on that, and educate them that in the near future, we are not going to make a profit. And that we will need, well, let me put it, that we will need county support. So three things: educate the board members that.
You just went out again, Mike.
Mike, you're gone.
Nope, still not working.
It's that one. Not yet, huh?
Yes, we
Yeah.
can hear you.
Okay. I keep switching back and forth to things. So in summary, we need to educate the board, especially that it's worth it. And in the short term, we need the support, financial support of the board.
So
Throw it out.
what I hear you saying is, and I could see this too, maybe adding an implementation technique along the lines of education or providing information to the decision makers and to the public at large regarding the importance of the neighbors, the status of the skilled nursing facility industry, and somewhere else, perhaps in the fiscal responsibility implementation technique, the fiscal responsibility, perhaps adding language to the effect of long-term fiscal solvency and self-sufficiency, recognizing either short-term or potential need for support in interim. So I think I think Carmen and I can craft something along that line as an amendment to the one, the other being an addition along the lines of education or informational. Actually, if I'm going to recommend that we use the word informational. Educational can come across as condescending. We're going to educate you, ignorant boobs. But providing information to decision makers, county board, and the public is certainly an implementation technique we can add.
I might suggest Mike emphasized the short term. I think that if it's going to be in the policy and directional plan, it probably needs to be phrased for ongoing. So perhaps maintain ongoing efforts to communicate the communal value of the neighbors to decision makers and the public, something like that.
And we also need to be careful in the language that we utilize regarding the potential need for fiscal support, financial support, but we can craft something along those lines. Carmen and I can.
Yeah, I think.
And if we need an author's touch on it, Supervisor McCullough, we'll bring you in too.
Yeah, I would certainly be available for that. Although I have to note that one of the things that I like about this is that it's clear, it is concise, it is tightly written. it's short enough that people who might not read something that even spilled onto 3 pages are much more likely to read it. And I find that that's an enormously valuable thing to do for documents like this, which are essentially policy and sales of policy.
Mhm. No, I appreciate that. In fact, the broader context is we had, we're working on 10 initiatives altogether and lump them together, and it can get quite lengthy. So some brevity and clarity is important for all of these.
Okay. So we're gonna have to wait for that before we do anything. Is this
Well,
correct or no?
I think that's the discretion of this committee. One option would be for us to make those corrections and simply send them to you. And if you have any questions, by email. And if you have any further questions on the changes or suggestions, we can accommodate those, but still forward it, understanding that the ultimate recommendation will be represented by Chairman Johnson's participation at the executive committee level. And because ultimately the update to the directional plan itself will come to the full county board, there'll be one last stab in case anybody has serious heartburn with any of those changes.
Okay.
For instance, on this one, because the changes are from Supervisor Kinnear, in particular, well, we'll make sure all the committee members see the changes, but in particular, Supervisor Kinnear will have an opportunity via email to weigh in on those after we've drafted them and before they go to the executive.
Okay. Is there anything anybody else would like to add?
Just a procedural question. Would you want a motion to move this forward provisionally to the exec committee with the understanding that staff is going to add provisions, language addressing the communication issue? So moved.
Is there a second?
I will second it, if you can hear me.
I can hear you. Gotcha, Mike. Is there any other discussion? And hearing none, all those in favor say aye.
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 Opposed?
Aye.
Was that an opposition, Steve, or no?
That was aye.
Okay, thank you. Motion carried. Okay, is there anything anybody else has at all? And hearing none, we are now adjourned. Have a good day, everyone.